Carlos Nelson with Cascade Media Group and What's Up Kansas City. And today we have one of our health officials on to talk about the C19 and the new virus prevention methods that are going on, the new vaccines and so forth. Who do we have here tonight?
Hi, I'm Dr. Marvia Jones with the Kansas City Health Department.
How you doing tonight, Doc?
Doing
Hey, Doc, talk to our audience a little bit about C19, uh, what we should be doing. And as I've talked to other health experts, and most of my people know I talk white and black, that we have to have our black healthcare people coming on, explaining to our community, excuse me, exactly what the situation is, because all kinds of games have been played in the past as it relates to vaccines and cures, and they fundamentally were experiments on black people. And so we're kind of hesitant. And so I'm so glad that your department was able to make this happen. So why don't you talk to our community a little bit about the things that you think that they should know uh, in general, and things that you might want to pass down to them as it relates to their kids, because they might be in the house, but the kids are out here acting like, you know, nothing's wrong.
Thank you, Mr. Nelson, for having me. And I do want to start by saying, although I am not a physician, I'm not a medical doctor, my background is in public health, so the population health, and how we engage in behaviors that affect our health. So I'll be speaking from that perspective. As everybody is fairly certain already, COVID-19 has been devastating on the Black and Brown community as a whole. This has been a disease that has made worse the conditions that were already present. So if you are already at risk of an early death due to your diabetes or high blood pressure or what have you, this has made it 10 times worse. And so people who are already kind of on the edge of trying to make sure they could get care and deal with some of their chronic illnesses, those families, all of our families, you know, I have the same issues in my family, and I worry about my parents and my relatives and my church members as well. We're seeing people having to be a lot more, think more carefully about their health care, and making sure that they are keeping themselves as safe as possible. My biggest message for your audience, excuse me, would be, we just have to hold on a little longer. This is not the time to start going back to our two-step parties or going back out. I know I almost cried a couple weeks ago. I think it was around Christmas, because I told my husband, I was like, I'm an introvert, but I want to have a party so bad. Just wanting to do something that you can't do. I know, I get it. It's frustrating and it's affecting all of our mental health in ways that we've only just began to understand. But we do need to hold on a little bit longer. Let's continue to avoid crowds, continuing to, stay at our, stay within our own
Cutting you
household.
off, and my
Mhm,
my
mhm.
my audience know I'm the cutoff king.
Oh, go
Uh,
ahead.
uh, talk to them a little bit about uh, the teenagers coming in the house and out the house, and how you look at that from a
Mhm.
personal and from a professional standpoint.
Yeah, that's an important
This program is brought to you by Clark Star Group.
question for a number of reasons. Yes, this disease so far has shown that people who are younger aren't likely to have as serious of effects in the near or the immediate or the short term. But we know that we don't just live with a house full of teenagers or a house full of young people. You know, your grandma might be in the house, or parents who also have high blood pressure or diabetes or obesity or other concerns. And so we have to be thinking about this not just as the individual, but as a group.
Cut
And
off again to
mhm,
our black population. The things she mentioned, we suffer the most of on the sugar and the blood pressure and what have you. And this disease will really affect you, and you really need to sit the kids down, not have a uh, passing by conversation, uh, because they're coming in contact and they're bringing that home, and you will be 6 feet under and wonder how you got there in the story.
Yeah. Yeah, we definitely see it that way. And one of the things that I've been thinking about, as my background is in psychology, is I think about how this is affecting families and the way they think about it. If you think about the trauma that families are going through when, okay, we had this gathering around Thanksgiving and grandma got sick and passed, or auntie is still in the ICU. What if we shouldn't have had this? Is it our fault that we had this? And youth who may feel feelings of guilt, people, we know the feeling of isolation is not healthy as well. And so we do encourage people to continue to find other ways of staying connected
Are
without
there
having
some
to
ways
be.
that you would recommend off the cuff?
Yeah. So I'm gonna be real honest. I'm tired of Zoom. Some friends,
Everybody is, because
yeah,
your job is using it, and you can't even use it for pleasure no more because you burn out.
it's not fun anymore. Zoom is not fun. Present company excluded.
Well, hold on. Let me tell you this. When I look at things, I think I've said this before.
Mhm,
I don't study for no interview or what have you. I talk from a
mhm,
layman and from I don't know whether it's blue collar, but I talk basically
mhm,
plain English. And
mhm,
everybody that has a job is tired of Zoom.
mhm,
And it's uh it's a mental
mhm.
frustration.
It is.
My daughter comes home. She's been with like the phone company, AT&T or Bell, for some time, and I about 20 years or 25 years. And when she gets finished with all of that in the and she come home, I just be stopping by to give something. You don't be in a damn good mood. And I've been dealing with this crap all day, or I've been dealing with the system, let's say. And then I come home. Then a young professional like yourself, you can't even afford to blow off steam
Mhm,
because now you come home, mommy, mommy,
mhm,
mommy, look at me, this and that. Went to see my granddaughter the other day, just for a little while. She was pawpaw, trying to make me see everything she was doing. I'm stressed from all the things I'm doing. I pay attention to this. Then I tell my son, Pop's got to go back to work. Nerves, nerves can't take it. And so
absolutely.
talk to what you're suggesting and let them know that they're not by themselves.
Absolutely. Thank you for sharing that. I'm with you. We can't depend just on Zoom. I had my sorors, belated Founders Day sorors, Delta Sigma Theta Incorporated. But we tried to have a Zoom party for Christmas, and it was almost more depressing for me to be on Zoom with them. We would be out somewhere usually. And so I would recommend not depending on Zoom. I know we leaned into that heavily, have a Zoom dinner with your family and all of that. If you're like me and you're tired of that, don't force that. I would recommend getting outside. That is the primary thing that I'm on right now. We know that studies have shown us that getting outside just for 5 minutes a day and being out in nature, you don't have to go far. You don't have to drive to a trail. Just get outside and walk around your block. Distance.
Marvia, tell me this.
Mhm,
I stay in the office 24/7, basically,
mhm,
right? And it's for
mhm,
a couple of reasons, because I don't need to be. I've had cancer, uh,
mhm,
radiation,
mhm,
have high blood pressure. I
mhm,
know I don't even need to be going nowhere but to the grocery store, get my prescriptions, and back in one location.
mhm,
But tell me, on the psychological thing, you might profile me. I don't be wanting to come out. And I
mhm,
know that I need to get out. If go downstairs, get out in the air, you always feel better. It's some psychological dark stuff, but you don't want to look at it. It's like, why am I so down? That's
Mhm.
how, and I'm real busy, but
Mhm.
it's just something right up under the surface, and it gives me a Orwellian
Mhm.
uh, type. Is this what the planet's coming to? I'm,
Yeah.
Mr. Nelson, just be real. Uh,
Yeah. Yeah.
and just like the covert came, Donald Trump came. It's like any damn thing to turn things upside down is possible,
Mhm.
and it's devastating for regular people, but it's compounded with blacks that don't have access to economics
Mhm.
per se. And could you
Absolutely.
talk anything about uh, possibly? I would think there's been an upsurge in marijuana use and narcotics and other things. Can you talk a little bit about that from a
Yeah,
mental
yeah.
health
So
standpoint?
we do know that nationally, we haven't, I don't have any data, local data to back this up, but nationally, we have seen data indicating that overdoses and the usage, so opioid overdoses and the use of other substances are definitely up. Alcohol use is up, we know. So yeah, we are not alone in feeling a little low right now. Collectively, we as a whole have experienced a lot of trauma. This is all trauma, and it's good to say that like Mr. Nelson just did of saying, I feel this dark, this deep level of just feeling sort of low right now, to the point where sometimes I just want to stay in. Like, even verbalizing that is healthy. And so the more, but if call a friend, like pick up you go old fashioned and pick up a phone and call your friend and have a conversation. That's one thing we can do. We don't have to see you, no one has to do that on Zoom. But you can just have a phone call. And then trying to make it, maybe start small and say, today I'm just going to walk outside to the parking lot and take a breath. So you talk about not wanting to go anywhere. Some of that is due to just the anxiety of it, especially if you are at higher risk. But it's understandable that in your mind it's safer just to be
Yeah,
inside.
but hold it. Let me say this to you.
Hmm.
In my mind, but
Hmm.
fundamentally, I never went anywhere, and that's not on my mind all the time. But I know it's supposed to be on my mind. That's what I'm saying. A million times I'm walking out just in the hallway without my mask. Take the elevator down without my mask, and knowing I get on that damn. Once I get out my office and get to the elevator, you don't walk back to get your mask. What the hell's wrong with you? You getting ready to get in something, people come on the elevator, different floors, somebody sneeze, next thing you know, you dead. And so
Hmm.
I think it's important to, like I said, that's my personal experience. And I think I'm halfway intelligent. People that ain't intelligent, they just don't even care or
Hmm.
not even thinking about certain situations. And I'm bringing you on uh, to
Yes.
accentuate that point.
Please wear your mask, everybody. I think that's helpful. And one benefit you can think about it is, what we do know is like flu infections have been down this year. I like that my kids have not been running nose all season. Usually from September through March, you're wiping noses and dealing with coughs, but it's a benefit. You protect yourself from COVID-19 for the most part, but you also could
So
protect yourself
before
from
we
other
close
stuff.
out, is there anything that you would like to let specifically the Black community and then the whole community, because y'all serve the whole community, and
Mm-hmm.
we want to make sure that people understand we're interested in the whole community, but right now our house is on fire, and we're interested in trying to put that fire out, and then we can
Right.
do some other things.
Right. So thank you for that opportunity. A couple things. Um, so I've been hearing a lot of misinformation going around about the vaccine. I talked to a lot of different people, and we always wind up at the topic: are you gonna get the vaccine? uh, and people have heard a lot of things. They've heard things like they're putting trackers in the vaccine and microchips, and
Hadn't
you
heard all
know
of that.
yeah, microchips and that,
But I know the Nation of Islam has been putting out don't take the vaccine. And so these are powerful leaders. And what does the layman person,
right?
Like I said, you can't believe everything. And it's
right.
Man, I just don't myself. I don't know. So I know the regular community. I was thinking earlier today, I was like, do you even try to get that vaccine? Maybe because they didn't had so many of these zombie movies and preparing. Hold it, listen. My belief, anything a man can think, he can do given enough time. And over the last decade and a half, they've been putting all these disease type movies out where getting the population prepared for this. From my perspective, I'm a conspiracy man.
Well, you have a lot of friends.
Yeah, I like that.
You have a lot of friends, and I would just what I would just like to leave with you is that people, please do your research, and if you have questions, actually ask the questions. Mr. Nelson, I'm gonna send this to you, but what I do like is that the LA County Health Department, and they've shared it with us, the Kansas City Health Department has a whole document combating the myths about the vaccine. And so I'm not telling people what to do and to get it. That's something you have a decision.
Send it to me so I can put. Is it in a flyer form?
Yes,
so PDF. I can put it on all our networks.
Thank you.
To help combat misinformation.
I love it.
It's almost like the witch doctor to a degree, but you've given the best advice I've heard. Not only listen to me, do some research. You got the smartphone. Don't be the dummy. Don't let the smartphone be the smartest one on the block. Get smart, talk into it, say, hey, can you give me some information on C-19?
Right. And so when the time comes when, they're working through the layers, who is the primary people who need to get it? It's healthcare providers and nursing home people and elderly individuals other people who are at high risk. But when it's time for me, I do plan to get it, which probably be March or April, but just in people who are seeking a vaccine. We do have a lot of calls come into the Kansas City Health Department. Continue that, keep it coming. We're here for you. I'm proud of the work that we have been doing and trying to improve on it.
Who's heading up your effort?
The Kansas City Health Department. We have a whole group of people who are taking calls from the community.
Give some of them people some action. Talk some names so that our community know these are the people that are working in these positions that are trying to keep you safe and informed.
Okay, at the top we have Dr. Rex Archer. We also have a robust communications department, Ms. Michelle Pekarsky, Bill Snook, and then we have the people on the ground who are going in and trying to keep you safe if you're out and about, Mr. Joe Williamson and others. There are a whole bunch of people. Here we are trying to do our best, and there's always room for improvement, and we appreciate your feedback that you've been giving.
All right. It was a pleasure having you on the show, Doc, and we look forward to you informing our community as things change in the next 2 months. And I'm from Cascade Media Group, saying that we appreciate the job that the first responders and that our health professionals are rendering to our community. And so, as we always say in closing, when you invest in your community, you're really just investing in yourself. Amen. Good night.
The program is brought to you by the Kansas City Business Association.